You're probably already aware of this story. Children's hospitals across the country reporting a mysterious illness that can cause paralysis in children, and that is on the rise. And while many patients can be treated, for some, the symptoms seem to be permanent. Joining us for a look at what we know so far is the Associate Chair of Clinical Programs in Pediatrics at Sick Kids Hospital, Dr. Jeremy Friedman. Good to have you with us this morning.
Thanks, Anne-Marie.
All right, doctors say the symptoms observed so far are typical of acute flaccid paralysis. So we don't know exactly how many cases right now are in Canada, but we do know 62 have been confirmed in the United States. How many cases have you seen at Sick Kids Hospital, and how fast do they appear?
So since the beginning of September, we've seen about a dozen cases at Sick Kids in Toronto, and we've been in contact with colleagues around the country, and we understand there's probably about 25 confirmed cases in Canada at the moment.
What are you concerned about as part of the medical team at Sick Kids?
Well, I think this is a serious condition for sure. It's also a very, very rare condition. In a general year at Sick Kids, we might see 1 or 2 cases in a year. So obviously seeing a dozen cases in a couple of months would be concerning for us. But bear in mind that when the regular risk is about 1 in a million, even with this cluster of cases, it's still in a very unusual condition.
What are some of the potential causes that are being investigated?
So it appears to be associated with some sort of viral infection because the children usually have some sort of virus, so just a common cough or cold or fever, and then suddenly present with the onset of weakness or even paralysis of a limb, maybe an arm, maybe a leg, maybe 2 arms or 2 legs.
And what age group should parents be most vigilant in looking for symptoms?
So all the cases we've seen are under 15 years of age, and most of the children are actually in the preschool age range.
When parents hear virus, they think contagious, and we're at back to school time now. So should there be concern in schools? What would your response be?
No, I think, again, let me emphasize, this is still an incredibly rare condition. So I think for the average parent, there's no major reason to be concerned. I think viruses obviously are contagious. The best thing parents and kids can do is hand washing. But acute flaccid myelitis that we're seeing at the moment per se is not contagious.
What kinds of warning signs, then, should parents be looking for? You described some of the physical symptoms.
Yeah, so I would say to parents that, again, this is unlikely to happen, but if your child in the setting of a viral illness suddenly presents with either weakness or loss of function or paralysis of one particular limb, then I would certainly seek medical attention immediately.
Very concerning for parents, especially when you have, very young children. In the school era, we know that there's lots of, less hand washing, more touching. Are you concerned that you're going to see more cases coming through?
I don't think so. I think we saw a not dissimilar cluster of cases 4 years ago in 2014. And if it behaves similarly to this, that seemed to sort of end towards the end of the fall. So we expect that actually this hopefully won't go on for too much longer.
We keep using the term polio-like symptoms. Is it related to polio in any way?
So all of these children get a full virological workup, and it's definitely not the polio virus, but there are some similarities. And one of the viruses that we have found in some of the cases, an enterovirus, which is a common cold or virus, can potentially cause polio-like symptoms.
Well, you are looking for possible causes. I know we've seen cases in the U.S., here in Canada now as well. Any other countries dealing with similar increase in numbers?
We have heard of a few cases around the world, but this does seem like predominantly a North American thing. Probably has to do with the timing of the seasons.
All right, Dr. Friedman, good to have you in this morning. Thank you.
Thank you.